The revolutionary Smart Lipo is the first and only laser-assisted lipolysis system to offer a minimally invasive procedure for the removal of fat. Using a high-powered ND-YAG laser, Smart Lipo is a new laser body sculpting procedure with significantly less downtime and side effects than traditional liposuction. What makes the Smart Lipo unique is the system's photothermal and photomechanical effects, delivering a 1064 nanometer ND-YAG laser, pulsed at a very high speed, causing the disruption of fat cells while promoting tissue coagulation, which tightens the skin.
The laser will act in the fatty tissue, producing two main effects. The first one is the thermal effect, where we will transform the light energy into heat. In doing this, we will disrupt the membrane of the cells and transform a dense tissue into a less dense tissue, an oily solution. The second important point is the photoacoustic effect. It means the shock of the laser beam against the cells and again disrupting the cells.
The laser's hemostatic properties allow for vessel coagulations, resulting in less bleeding, less bruising, and less trauma.
Smart Lipo differs from traditional liposuction. Number one, in that we're doing it under local anesthesia, so it's very safe. We get very precise results. The recovery time is much faster. Most of the time we tell patients to take off a day or two after the procedure, and then they go back to work the next day. And finally, it allows us to tighten the skin where we could not really do this at all with traditional liposuction. And in areas where the skin was sort of loose or flabby, traditional liposuction can actually make it worse. The ideal candidates for Smart Lipo are really people who have small, localized puffs of fat. It can be the neck area, the upper arms, the abdomen, thighs, and hips. Often we can treat areas where they do have puffs of fat, but they also have loose skin. And that's a major advantage of this new technology. Good morning, how are you?
During the consultation, the possibility of complications that may occur should be discussed with the patient. A blood test or prophylactic medications may also be administered at that time, and a consent form should also be signed. Pre- and post-operative instructions are also given to the patient and may include the following. Arrange for transportation to and from the office. The patient should not drive themselves after the procedure. The patient should drink large amounts of water for 1 week prior to the procedure. The patient should wear comfortable clothes. A button-up shirt may be easier to remove. Prior to the procedure, the patient may want to have a light meal. Please refer to the Smart Lipo Clinical Manual for additional information. Throughout this video, we will be demonstrating the Smart Lipo procedures on the submental area and the upper arms. But let us first address preparation for the treatment. To begin, review with the patient the area to be treated and post-treatment instructions. Clean the area to be treated and administer a sedative. Next, use a sterilized surgical marker to clearly define the locations to be treated. Once the patient is lying down, apply a local anesthesia appropriate to the procedure using the incision marks as a guide. Next, using a trocar needle, create 1 millimeter incisions at the treatment sites for the introduction of the tumescence anesthesia and laser fiber. It may be helpful to use scissors to snip and further open the incision locations. Tumescence anesthesia may be used based on the volume of fat to be removed.
We're infusing the tumescent anesthesia into the skin, into the subcutaneous space. We'll probably be using about 200 or 300 cc's for both arms.
To prepare the laser device, you will need a sterilized cannula, fiber optic, handpieces, and a fiber stripper and cleaver. Cleave the fiber when you need to expose more fiber to thread the cannula. The fiber should be bare to extend through the entire cannula 2 to 3 millimeters. Thread the fiber and connect it to the laser. You must turn the key to activate the laser. Before arming the laser, the patient and all persons in the treatment room must be wearing appropriate protective eyewear. Program the laser settings on the touchscreen panel as required. We suggest using the following treatment parameters: a 1064 nanometer ND-YAG, 150 joules, and a repetition rate of 40 Hz. Next, put the laser on the operate mode and step on the foot switch to begin the lasing process. We will be demonstrating the smartlipo procedure on the upper arms. Now, let's begin.
Usually the arm takes about 25 or 30 minutes for both arms. So it's a very quick procedure. What we do with smartlipo is we make tiny incisions. They're so small, in fact, that we don't even have to suture them. We thread the laser fiber under the skin, and we can actually see the tip of the laser fiber because it's flashing red, and we direct it in the areas we want to melt the fat. I think it's important that people realize there is a learning curve to smartlipo. You do need to have some experience with liposuction as well as with lasers, but if you do, you should be able to get up and running pretty quickly.
Here are some important tips. The red aiming beam should be used as a visual guide. Continuously move the laser fiber throughout the treatment area. Move the laser fiber in a fan-like motion. And do not leave the laser fiber in the same area for any length of time, especially when near the skin.
You see, where we've marked the patient, we have different incisions in the front and the back of the arm, as well as over the elbow and in the axilla. And this allows us to perform multiple crisscrossing tunnels of the laser fiber.
Initially, there will be some resistance as the laser moves through the adipocytes, but the flow will become smoother.
It's a strange sensation with a tiny little pinching.
We are actually penetrating very superficially. We're really just under the dermis when we're using the smartlipo device. So we thread it along under the skin. If we want to be melting fat deeper, we can actually move it deeper in the fatty layer.
Continue to reciprocate the handpiece and fiber back and forth in a fan-like motion, moving the cannula to various depths. You may continue this motion until there is sufficient disruption of the fatty tissue.
We're feeling the change in the thickness of the fatty layer, what we call the pinch test. That allows us to determine how much fat we've removed and that the removal is evenly distributed throughout the area we want to work with.
To remove the liquefied fat, you can use a 2mm cannula with a 60 cc syringe. We also can use a pump to aspirate the fat.
This is the typical aspect of the treated tissue. It's completely yellow.
A major advantage of smartlipo is patients can actually be awake during the procedure. And this way they can sit up or stand up, and we can see how the areas we're treating appear when they're in their natural positions. It's also nice because patients have very quick recovery. They don't have to be in a recovery room for a few hours because they had general anesthesia.
After the procedure is completed, the area should be bandaged and a compression garment is to be worn for several days.
In terms of post-op care, we tell our patients that there will be some drainage for the first 24 hours, so they really should stay at home and relax. We ask our patients not to exercise for the first 2 weeks after the procedure. We just really want them to take it easy, but they can do their normal activities at work, and it's really easy for them. There's really very little pain because the post-op discomfort is really minimal.
Smartlipo, revolutionizing laser body sculpting and laser-assisted liposuction. For more information, please contact Cynosure at 1-800-886-2966 or visit us on the web at www.cynosurelaser.com.